Hi guys, in this video you will know that how our kidneys works, how it fails, how dialysis process performed, and at last how doctors transplant kidney. One of the key functions of the kidneys is to clean the blood. As blood circulates through the body, it picks up extra fluids and chemicals. The kidneys separate these substances from the blood and they are then eliminated from the body in the urine. If the kidneys fail to do this and the condition is left untreated, it can lead to serious health problems and even death. Kidney stones form when particles in the urine build up and stick together. They can block the flow of urine, which can lead to serious health problems and even death if left untreated. The kidneys are located in the posterior abdominal wall on either side of the vertebral column. The adrenal glands sit on top of the kidneys. Medullary pyramids and the outer cortex form the renal lobe branches of the renal artery. Each renal lobe supplies the smallest branches of the renal lobe called efferent arterioles. Each nephron consists of a renal corpuscle and a renal tubule. The first step of urine production, called glomerular filtration, occurs in the renal corpuscle. It consists of a network of capillaries called the glomerulus and Bowman's capsule. The diameter of the efferent arteriole is larger than the diameter of the efferent arteriole. This difference creates higher pressure. Small substances such as water, nitrogenous waste, amino acids, glucose, sodium ions, and calcium ions are separated from the blood into Bowman's capsule through small openings in the membrane. Other substances, such as plasma proteins and red blood cells, are too large to pass through this membrane and remain in the blood. During the second stage, the fluid passes through the renal tubule, which consists of the proximal convoluted tubule, loop of Henle, distal convoluted tubule, and collecting duct. As this fluid passes through the renal tubule, it reabsorbs useful substances into the peritubular capillaries, particularly glucose, amino acids, and some sodium through active transport. The peritubular capillaries reabsorb water through osmosis. The final stage of urine production is tubular secretion, which mainly occurs in the distal convoluted tubules. These tubules remove hydrogen ions and excess potassium ions, as well as larger nitrogenous wastes from the peritubular capillaries, and these are excreted through the tubular capillaries into the urinary system until they are eliminated from the body in urine. Dialysis is a process by which waste products are artificially removed from the blood, so that excess fluids and electrolytes such as sodium and potassium in the abnormal functioning of the kidneys contained in the waste of a healthy kidney are removed from the body in the form of urine. In the case of kidney disease results in increased kidney function. The moisture in the body thus leads to other complications, such as hypertension, heart failure, pulmonary edema, metabolic acidosis, and hypokalemia. Dialysis is done in the following cases. Colme: A. Serious kidney disorder or two medications or POTU. Dialysis to remove toxins can be of two types. Hemodialysis can be of two types. This prenatal dialysis is done with a hemodialysis. It is a machine outside the body that removes toxins from the blood. A vascular access site, first listening to the area with local anesthesia and plastic to one of the arteries. The tube or arterial venous fistula makes an arterial venous graft with the help of alcohol, but directly connects one of the arteries with hemodia or hemodia. At the beginning of the procedure, two needles are inserted into the patient's fistula or graft, which establishes a circuit through which blood enters the dialyzer outside the body through the dialyzer, which consists of filtering fibers that remove excess fluids from the blood and extra fluid from the blood, and a dilator that serves as a solution for the substance that is not absorbed into the blood. The second needle in the place of the axis is returned to the body through the tube. When the hemodialysis session is completed, the needles and tubes are removed and the patient is allowed to return home. A soft catheter is inserted using the peritoneal lining of the abdomen without external ejection of blood from the body, through which a soft catheter is first inserted, through which a button can be made near the port. Each session of peritoneal dialysis is known as an exchange. The abdominal cavity is first filled with dialysate using a catheter, which is determined by the doctor through peritoneal membrane. Waste products and extra fluid is continuously extracted from the blood into dialysate, which is eventually transferred to the sacs during collection. Kidney transplantation is a surgical procedure in which the healthy kidney of a living or deceased donor is transplanted into a patient with end-stage renal disease or kidney dysfunction. The operation replaces the patient's non-functioning kidney with a healthy donor's kidney, restoring their ability to filter waste and remove excess water from the blood. The surgical site is prepared in the lower abdomen of the recipient. The deceased kidney is left in place or can be removed. In the event that the donor's kidney receives is applied to the lower part of the donor's abdomen. The renal artery and the donor's kidney vein are connected to the recipient's iliac artery, and the vein is folded to blood. The surgical team monitors the growth of the kidney and the production of urine once the urethra and urinary connections are made to allow the recipient's bladder to drain urine. To ensure that the incision is closed and the recipient is moved to the intensive care unit to be closely monitored. The post-operative period to the recipient colme, closely monitored for signs of infection or complications. Blood tests and imaging studies assess kidney function and guide medication adjustments. The patient is educated about following the prescribed medication regimen and has regular follow-up appointments.